This video explains the main steps to disconnect an indwelling pleural catheter, also known as a PleurX, from a continuous drainage collection system like a PleurVac. The detailed protocol of the procedure is available on the MUHC intranet in the Policies and Procedures section. Search in the alphabetical section Drains. Always use PleurX material, devices, and access kit to connect to the catheter. Otherwise, damage to the one-way valve can occur and cause complications such as a pneumothorax, infection, or malfunction of the catheter requiring its replacement. You will need the following supplies: one minor dressing tray, sterile normal saline to clean the insertion site if needed, one pair of sterile gloves, two alcohol 70%, chlorhexidine 2% swab stick, two alcohol 70% and chlorhexidine 2% swabs, one PleurX valve cap, 2 to 4 sterile 4x4 compresses, 2 drain sponge compresses 4x4, 1 semi-permeable transparent dressing, large, 15 by 20 centimeters. Before disconnecting the PleurX from a continuous drainage system, wash your hands. Wear appropriate PPE if the patient is in isolation. You need to wear at least a surgical mask and ocular protection because there is a risk of splashing pleural fluid when you disconnect the drainage line. Identify your patient by using double identifiers. Explain the procedure to the patient. Take vital signs. Assess pain. Ensure privacy by closing the door or pulling the curtain. Position the patient comfortably. Clean work surfaces. Perform hand hygiene. Open sterile supplies onto the sterile field. A minor dressing tray, PleurX valve cap, drain sponge compress of 4x4, sterile 4x4 compress, semi-permeable transparent dressing, large, 15 by 20 centimeters. Don non-sterile gloves. Partially open the alcohol 70% and chlorhexidine 2% swab stick and place it on the side of the table. Remove old dressing. Unlock the drainage line by rotating the access tip. Disconnect the drainage line and examine the catheter, the insertion site, and sutures if there are any present. Sutures are usually removed after 2 weeks. The polyester cuff should not be visible at the surface of the skin. If the skin is visibly soiled, use normal saline and supplies from the dressing tray to clean the skin. Allow the skin to dry completely or pat dry with a sterile gauze. Take a chlorhexidine swab in each hand and clean the catheter from skin towards the valve, only touching the catheter with the swabs and not your gloves. When you reach the end of the valve, scrub the valve for 15 seconds. Make sure once you have cleaned the catheter, you don't touch it again with your gloves. Keep holding the catheter valve with the chlorhexidine swab using your non-dominant hand. Take an alcohol 70% and chlorhexidine 2% swab stick and clean the skin for 15 seconds with vigorous friction in one direction and clean for 15 seconds in the other direction. You should clean an area larger than the size of the dressing. Be careful not to pull the catheter. Do not remove any scabs. Gently bring the sterile field close, holding the edges, and drop the catheter onto the sterile surface. Place the disinfected catheter down on the sterile field. Allow disinfectant to dry completely. Alcohol 70% and chlorhexidine 2% takes at least 2 to 5 minutes to dry. Do not blow or wave your hand to speed up the drying process. Remove used gloves. Perform hand hygiene. Don sterile gloves. Place a new sterile cap on the valve. Twist clockwise until a click is felt. Place the drain sponge compress around the catheter insertion site. Wind the catheter into a spiral and place it over the drain sponge compress. Do not make a knot or kink the catheter. This could damage the catheter. This will allow the catheter, including the valve, to be completely covered by the dressing. Cover the catheter with two 4x4 sterile compresses. The catheter should not be in direct contact with the transparent film to prevent accidental dislodgement when removing the dressing. Apply sterile transparent dressing film. Dispose of supplies and clean working area with disinfectant and allow it to dry. Remove gloves. Perform hand hygiene. Document vital signs in Oasis or in MedUrge. FOCA evaluation can be done on the pleural drainage documentation form of DM2569 or on the input and output sheet in MedUrge. Tolerance to treatment or any side effects should be done in the progress notes using the DARP recording method.